for me because it is Asthma and Allergy Awareness Month. And in case you didn't know, I wrote this lovely book, Mommy, I Can't Breathe, The Modern Guide to Navigate Asthma and Allergies. And I wrote this lovely book, No, Renee, You Are Allergic. So asthma and allergy is very near and dear to my heart because I hate to, I don't say suffer. I am a survivor of both. Um so since it's such a big month, my show, the Ask Dr. Renee show, is going to be right here with blackdoctor.org. So welcome to the Ask Dr. Renee show. And for those who've never watched, we're here to motivate and inspire you to live the life you deserve. And we're going to give you great information about asthma and allergy. So please share the broadcast, share the broadcast. Don't forget to share the broadcast. And I don't care where you're watching, just make sure you share it. Thank you for the thumbs up, whoever that was. And so today is really funny because my guest, I have no idea where she is. So I am so blessed and honored that we are going to have my actual doctor, my allergist, is going to join us today and give us great information about asthma and what else? Allergies, of course. So I know you know somebody that suffers from asthma or allergies and suffers because I know a lot of people suffer. I'm one that's not suffering, but there's a lot of people that do. So please make sure that you share this with them because this will be great information that they can use for themselves, their children, grandchildren, cousins, auntie, uncles, friends, whatever. Don't forget to let us know where you're watching from. And thanks so much for tuning in, and let's get started. Good evening.
Hello. Am
I
I
can
coming
hear you.
through?
Perfect.
Oh,
Yes.
good. Great. All
And I
right.
just
Well,
noticed something.
what's that?
Here we go. Okay.
Oh,
So,
okay. Thought it was
so
me.
this is Dr. James Thompson. He has a practice in the Chicagoland area. Um, and he is excellent at what he does, and he's really good at explaining all of it. So, can you first, let's start at the
Thank you.
beginning and explain what is asthma?
So asthma is a constellation. It's a host of symptoms, more like a syndrome, but it's usually not referred to that. But it's a constellation of symptoms that it can involve any one or more of these symptoms: cough, wheezing, shortness of breath, or chest tightness that tends to go and come, tends to not be um, chronic, progressively severe, except when it's so severe and untreated that it can become chronic. But the difference between it and other chronic respiratory diseases, it's reversibility, and it can be triggered by allergens or irritants or infectious agents, and involves invariably a degree of inflammation. So again, it's chest symptoms that are caused by a constriction of the lungs that can manifest as either cough or wheezing or shortness of breath or chest tightness that tends to be intermittent, sometimes going away on its own or often with treatment if it's more moderate to severe. And it can occur at any age.
So, a lot of people, for some reason, they're told, oh, you don't have asthma, you have bronchitis. So, what's the difference and why?
Yeah.
And I think a lot of people
Yeah.
are misdiagnosed.
Yeah, that's true. There are a number of issues there. Sometimes it's difficult before school age to make the diagnosis because there's something called early wheezers and transient wheezers, where when in the early development of the lungs, because they're so narrow and they're not fully developed yet, there may be some wheezing that doesn't really represent asthma and that tends to go away by school age. And so some pediatricians and family practitioners and some allergists are a little hesitant to say it's asthma early on and may give it other names that we've tried to avoid these days, like reactive airway disease and things like that. But say it's someone that is older than 5 and they have some recurrent wheezing or shortness of breath or chest tightness. For us, it's really asthma until proven otherwise. You do want to make sure there aren't other causes, but it's often called bronchitis, but bronchitis is not really a diagnosis. Bronchitis is a description. And it says it reflects inflammation of the bronchial airways, but that's not a codable. Doctors can't code and discuss and communicate with other doctors saying just bronchitis. You have to put something in front of it. Like acute bronchitis is usually an infectious thing, like due to a virus or bacteria. Whereas chronic bronchitis, we often think is smoking related. There are some other causes too, like if you work in a chemical factory or exposed to toxins on a regular basis or a frequent basis. But most commonly in this country, chronic bronchitis is related to smoking. So we don't usually see children, young children with chronic bronchitis.
I'm still
Now they
listening.
may have acute bronchitis or tracheal bronchitis, which is often viral, sometimes bacterial. But usually when patients are referred to me and they've had recurring bronchitis, which is still not a good term to use, but when they come in with that term, I think that there's a 8 to 9 out of 10 chance it's asthma. That's the most common thing that causes a recurring inflammation of the bronchial airways. And the bronchial airways are where you go past the trachea down towards the middle of the chest, where they split into two. Those are the left and right bronchi. Bronchi is the
So
plural
like
term
the
for
branches.
bronchus. Hmm.
So the
Yep,
trunk and then the branches that come off.
that's right. The lungs are like an inverted tree. If you take a nice healthy tree, the trunk of it would be the trachea. And then when it starts to branch off, if it had two major branches, those would be the bronchi. And then it branches off into 23 divisions of smaller and smaller and smaller airways, such that there are about 1 million of tiny little airways on both sides of the lung, so that you can have a nice large area for oxygen exchange.
So I have I was born this way. So I tell everyone that. And my mom, because she was a respiratory therapist, she knew. She said this child is wheezing, and just like you said, the doctors were like, "That's not possible. She's too young." And then they said, "Well, let me listen to her." And my mother was calling, so she put the phone to me, and the doctor said, "Oh yeah, she is wheezing." I said, I know this.
Yeah,
Now
yeah,
what? so
yeah.
so I was started in treatments very, very early because I had such issues. And then I also my mother realized that I was getting sick from oatmeal. And so she was like, wait a minute, she must have food allergies and they're causing her to have these asthma attacks. So that's when I learned of my allergies originally. And it was a very long list.
Wow. Yeah.
Very, very long. The list in my book ain't too bad, but the list then was awful. But so I'm very grateful that because crackers was on it, Ritz crackers. I love
Oh, gee.
crackers. I was like,
Yeah.
I'd be very upset if I couldn't eat crackers. But so for people, because I know lots of adults are all of a sudden being diagnosed with asthma, with allergies. Is there
Mhm.
any reason to that, or is it just the body just changes over time?
Well, the majority, probably a little around 60% of the people in their first decade of life will display or reflect something that suggests they have asthma if they ultimately are going to have asthma. But that leaves a large percentage that might be later. And so there are some people that don't have the diagnosis till after their 30s. It tends to run a course that's more challenging when that happens. But you can develop asthma at any time in your life. I've diagnosed asthma in some 70 and 80-year-olds, and they don't recall having it before. So it is something that it's genetically driven, but in a way where these genes may not be expressed to the same degree or may have a delayed expression in life. And it's more than genes, it's also the environment. So something in the environment may trigger it, especially if you have allergies or certain viruses. We know in children, sometimes when they have that early RSV, that respiratory syncytial virus, there's a higher degree of asthma development, especially if they also have allergies. So there's a lot of variables involved, and it's unlike certain diseases where it boils down to very statistically repeatable and predictable consequences like sickle cell or cystic fibrosis, things like that. It's multiple gene, more than 5 to 10 areas in different on different chromosomes that tend to add up to it. So it's a combination of that genetic risk, that genetic vulnerability, and and environmental exposure. So we in the Midwest where I am and I believe you are, there's a lot to trigger it, both allergic and irritant with the pollutants, the industrial, the fossil fuels emissions, things like that. And so, we see a lot of it, but you're never too old for it. A lot of people are first diagnosed in adulthood. The one thing I like about the allergy specialty is I can see all ages. So I see the natural course of it. I can I can see people when it develops later in life, and I can follow them through life. So that really gives me a good understanding of it.
So I, in my studies and life, I discovered a lot of people never didn't know what an allergist was, were never told that they should go see one. So when do you think someone should go to an allergist?
Yeah, I used to use this term. I don't use it anymore because it dates myself. I used to say that the allergists are the Rodney Dangerfields of specialists, but some people look at me funny when, who the heck is Rodney Dangerfield?
I know who he is.
But anyway, okay, good. He was a comedian that always used to say he gets no respect.
Right,
So, so allergists used to feel like we get no respect because a lot of people, it was a hidden science. And really what changed it was direct to consumer advertising when they started advertising those antihistamines and showing flowers chasing after people and all that. And people are like, oh, that's allergy. And then they started actually asking their doctors about it. But yeah, so we when you decide to go get when you should take your child or yourself to see an allergist is when it's starting to impact your daily routine or your nightly routine. If it's disturbing your sleep, if it's causing lack of concentration, school grades may be low because child's so sniffly and snorty and coughing. These days, you get the side eye from people with a lot of coughing and
you
sniffling.
sure do.
Well, so a lot of people are making their appointments now because people are paranoid now. They're coughing so much and they get sent home a lot sooner.
Right,
But yes, whenever it's disruptive to the lifestyle, whenever it requires multiple medications, whenever the frequency of it is more than once or twice a year, and if it especially if it requires an emergency department visit, then it's warranted that you should try to figure out what those trigger factors are, and that's
right,
that's what allergists do. And we spend a lot of time getting an idea what the environment is, what triggers it. Not just allergens, but irritants. Some people's weather changes. It can be fragrances and fumes. People like the smell of incense, and they don't realize it's killing them. Some cosmetics. Um, I missed it in a pulmonologist actually years ago. After I saw a patient, I tested her. She wasn't allergic. Put her on some medicine, and she ran into a pulmonologist who had a very keen sense of smell. I don't, but anyway, he said, "Well, stop wearing your perfume, and all the cosmetics." And she came back to me and said, "When I stopped wearing all my perfume, I started feeling better." Well, that was a lesson for me. I gotta check every box. But yeah, sometimes it's those really mundane things you never think of. Fragrances in your pillowcases.
well,
You like to
I can
bounce.
I can
Hmm.
tell you first. I had problems with the hairspray.
Hmm.
I would start wheezing when they would spray my
Hmm.
hair, and so
Yeah.
they had to make sure that they covered me good before they tried to spray it down after my fresh press. Have my press and
Hmm.
curl, and then they want to finish it off with some sheen or something. And soon as you go, I'm like, and then,
Yeah. Yeah.
I used to also
Yeah.
have problems with walking through the mall and the perfume department and all the samples, and I'm like, no, 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 no.
That's
Um,
right.
and what other odd things? Um, I think those
So,
were like the
so,
oddest, but I really honestly don't have a problem with perfume. And I like Bath and Body Works, all that stuff. I did all that back in high school and college. And even hairspray. I don't really use hairspray now, but it's not aerosol either. So that
mhm,
probably helps a lot. Now seasonal, I had seasonal issues. Growing up in Michigan, when the season changed from fall to winter and spring and but winter to spring.
mm,
So October and April were my triggers, and it just was never a good time. I was spending a lot of time in the ER. I was one of those children, though. I was just such a nerd that I went to school the next day. Asthma attacks for me happened at night. I'd wake up in the middle of the night, couldn't breathe, go tell my parents I can't breathe. My mother would do her best to try and get me straight, and if she couldn't, then we went to the ER, and that's
yeah.
just the way it was. And so I guess because of the drugs that they gave me at night, I was fine at school during the day because
Mm,
no one ever said Renee was sleeping in class. So I guess the epinephrine and all that, I was high as a kite and I was good to go.
yeah, those were the days.
Right? Look, now I'm like, I
Yeah.
need my sleep.
Yeah.
But
Yeah, we all do. We
right.
all
And
do.
my parents, I don't know how they function because they functioned because it
Yeah.
was a lot of ER visits October and April, like
Yeah.
every other night, to the point that the triage nurse knew us
Yeah.
and we didn't have to go through triage. We just went straight back because,
Yeah.
oh, here comes Renee. And, that's the way it was. I
Yeah.
will say that I had allergy shots as a child, and allergy shots really tremendously changed my life.
Mhm.
I mowed the lawn in high school, which
Mhm.
I'm allergic to grass. I,
Mhm.
I walked the lakefront in Chicago after they've mowed the lawn and I don't have a problem. I walk the
Mhm.
lakefront when all those dandelion things are flying. I don't have a problem. So, allergy shots really did change my life. And I always tell everyone,
Mhm.
if they suggest allergy shots, please take
Mhm.
them up on it. And I've
Yeah.
I've talked to so many parents who are like, well, I don't want him or her. Trust and believe that you will be so thankful that your child had those allergy shots, because it will save you time in the ER, save you time at the doctor's office. I mean, it'll save you money. Just get the allergy shots. Just take them. But I'm in a lot of allergy groups, and they really make me think that allergists are horrible people. And I'm just like, but I know they're not. I know. And so I'm always defending you guys, like,
Yeah.
oh my God, please listen to the allergist. But
Yeah.
this is one thing that bothers me so. Don't do this. Now, your child, you give him whatever, and you notice something. Go to an allergist and have an allergy test done on whatever that something was. Now, why do people, I'll never understand this, maybe you give them one thing, but then you go have them tested on 30,000 things? And I'm like,
Yeah.
well, did they ever have a reaction to that? Why would you go test for that?
Yeah. You mean when you get a whole battery of tests, like
Right. And I mean, and
foods and
I
all?
understand some things are in a
Yeah.
family. When things are in a family,
Yeah.
that makes sense. But when
Yeah.
you, so and so was allergic to nuts, but then you had him tested for egg. And I'm like, but you've been giving him eggs every day and he doesn't have a problem. Why did you have him tested for egg?
Yeah. That's a battle we actually have tried to fight, the flagrant ordering of tests. Now, what the reason why that happens is because the next best thing to a skin test is a blood test, which any doctor can order. It's just that A, many times it goes way beyond what it needs because allergists spend several minutes honing down on what we need to specifically address.
Right.
And then B, there's the lack of understanding if you're not an allergist of how to interpret the tests, especially if they come back with a lot of positives and the patient or parent tells you, well, I eat that and I do okay. you know, or say the grass pollen is off the chart, class 6, but they do fine in May and June. Well, that means it's a false positive. Now it's confusing to some other providers that aren't aware of that kind of relationship. It's not just based on test results, not even just skin test results. Even skin tests you can be thrown off. You have to interpret them within the context of the history, the pattern of what seems to be the problem with the patient's symptoms and illness. And so that's what we're trying to do. And so that means we need to ask a lot of questions before we order those tests.
Right.
The
And,
biggest pet peeve is the broad food battery, because undoubtedly a person is very allergic is going to have some false positives just
right.
because of the nature of the test.
Yeah.
Then we have some splaining to do.
It
Yeah,
and that's why you have to, that's why I say you need to go to an allergist. I
yeah,
love all my primary care physician friends
yeah,
and colleagues, but I know and they know they didn't go to the Allergy and Immunology conference that
yeah,
was held every
yeah,
year to talk about all the latest and greatest. And so it's just best that you go to the
yeah,
specialist who has done all the homework to learn
yeah.
all the new stuff. Because my mom was a respiratory therapist, and I had a really an amazing allergist, Dr. Marva Morris, may she rest in peace. She was
Hmm.
a FIS graduate, and
Hmm.
first black woman I ever saw that was a doctor, and I was very
Hmm.
young and was blessed that that's who I got to see. And she became my
Right.
pediatrician, because if you read my book, you'll find out my mother fired my pediatrician. Um,
Oh yeah, I got it. I got it
oh
right
yeah,
here. Yeah,
yes,
here it is. Yeah,
I
see.
love it. Thank you.
Yeah.
So yeah, so my pediatrician became Dr. Marva Morris, and she was on top of things, and my mother was on top of things. So when new
Hmm.
drugs came out, they switched, I was switched to new drugs. When new,
Hmm.
I had always had the latest nebulizers because my mother was a
Hmm.
respiratory therapist, and she would make certain I had the latest and greatest and the biggest, the smallest, and whatever. We had the newest spacers, whatever they were for my inhalers. And so that's why it's important for you to go to an allergist. I
Yeah.
think that an allergist or a pulmonologist,
Hmm.
one of the other,
Yeah.
or one or the other. But if you have allergies, you don't necessarily have to have asthma. So if you have allergies, you should definitely see an allergist. But
Yeah.
if you have asthma and allergies, you could go to either or. Um,
Yeah.
but it's really, really important that you see an allergist. Now, there are so many people now coming up with nut allergies and egg allergies.
Yeah.
I tell everyone I have an egg allergy, but I can eat egg baked in things. And people are like, huh? And I was like, the proteins change. Am I wrong?
Well, they can, yes. There are different ways people can be allergic. There's a type of blood test now called egg component testing, which can differentiate those that may be able to tolerate cooked egg and have low risk versus those that, no matter whether it's cooked, raw, whatever, may have a severe reaction if they were to be exposed to egg. And so yes, there's kind of two groupings there. There are those that can handle it when it's just a second or third or minor ingredient and cooked, and there are those that can't have any part of it. So it really depends. You would never assume.
Right.
So there, yeah,
And I
but
didn't I don't know when I started having baked in, but I eat pancakes, cookies, all sorts of
yeah,
things that it's baked in, but
yeah,
I do not eat scrambled eggs, omelets,
yeah,
meringues and stuff like
yeah.
that. Um
Well, one thing I found that helps, and when people are referred to me and they've been on these wonderful medicines already, because it's more challenging for allergists these days because the primary doctors, the primary caregivers are more in tune with algorithms of how to treat it. So it used to be when we were the first introducing patients and children to nasal steroids and to inhaled steroids and spending a lot of time explaining to parents, this is why your child needs to have this steroid, because steroids had that kind of
yeah,
bad rap for a
get
while.
it.
Now people come in asking for it. Give me the Nutella or steroid. But in the old days, that was the deal. But the issue here is that if you don't have something that's dealing with the inflammation, then you're not going to have control over it. And people don't realize that the more they need their reliever inhaler, the more that reflects poor control. So there's two elements. There's one is um, control, and the other is dealing with acute symptoms. So acute symptoms, we know we have the albuterol type. Control is what you take when you're no matter what, when you're well, when you're not well, and that's what we have to really influence parents and patients to do when they're well, not to just stop their medicines. Because if they have a certain level of severity, that means they should keep the foot on the pedal and be taking the medicines long after they're better. A big question is, am I going to need this the rest of my life? And what I usually tell people when they're not at the far end of the spectrum where they've been in and out of the hospital a lot, that I said it depends on you. It depends on if you follow the guidelines and make sure you have this under good control before you stop taking the medicine or start forgetting to take the medicine. So, so, so it depends on you whether you're going to need this the rest of your life. If you don't do it right, you could. So,
And I was the queen of forgetting to take my medicine. But
yeah, yeah,
but I I am fine.
yes.
I'm well.
Well, you matured in your thinking, and you
No,
went along with them.
I don't have to take them anymore. But I will say this though. And people think I'm crazy, but exercise really changed my lungs.
It can.
And
It can.
obviously because of my lungs, I didn't just jump up one day and run a mile. No, I didn't do that. It was
Right.
a gradual thing, but over time, it got so much better that now I do the Peloton bike and I can bike very fast and I can run. I can run, for a long time without stopping. Most of the times I don't even need my inhaler, which is surprising to me still. But I've done several races. I did two 5Ks, two 10Ks, and a half marathon. Um, And if you read the book, you'll find out what happened with the half marathon. But I got my medal. But, but
That's
you know,
important.
what'd you say?
I said that's important.
I thought
You,
it was. It was that
yeah.
was my reason for going.
Hmm.
I've never been an athlete, so for me to get a medal, I was really excited about this.
That's great.
So when I say that exercise changed it, because people look at me and they're like, I can't breathe. I go, that I was you. I was that person.
Yeah.
And you just have to do a little bit by a little bit by a little bit. And it's amazing what'll happen. If you have questions, don't forget to post them in the chat and I'll try and get to them. But it really did change things so much so that I had my pulmonary function test and I sent the results to my mom. And my mom said, Renee, HIPAA, you can't send other people's medical results to me. I said, Mom, those were mine. She was, she said, your lungs never looked this good. They looked this good when you were born. I said, well,
Mhm.
I said, all
Yeah.
of that running and walking apparently is doing something to my body. She was like,
Yeah.
oh,
Yeah. Exercise is underestimated, um, and we don't do enough of it, and we've become more and more a sedent society. So it's a challenge getting people to exercise more. Now with the pandemic too, there's a lot less movement than should be. So we've been a little busier, I think, partly because of that.
and I tell people I didn't really know, even with losing weight, I didn't know I didn't know that I was in such bad shape until I wasn't anymore. So with my
Mhm.
asthma, I think I had just learned to live like that. Like
Yeah.
I didn't never expect to
Sure.
breathe better. So it just was what it was, and it wasn't a big deal to me. But when I was able to breathe better and like inhale, oh my God, it blew my mind. I was like, I
Really.
never I didn't know I could breathe in this deeply because I never could. When I breathed in, it was real shallow, was and that was about it.
Yeah.
All of a sudden I
Yeah.
could I was like, oh my
Yeah.
God. And then you know what else? This is my little thing. This is how I know if I'm sick. I blow out candles. So if I can blow out the candles, then I'm good. But if I have to and I can't get them out, then I'm not feeling well.
Yeah. Breathing is a beautiful thing.
It is, and people are like, I said, because people comment on my videos, my asthma
Mhm.
videos on YouTube all the time, and they ask me stuff, and I was like, if you can't breathe, I think you should probably go see somebody and quit sending me messages. Like, I mean, I said, there's a
Yeah.
few things you can live without, but breathing is not one of them. So if you're having
It's
trouble breathing,
yeah, when we learned about advanced cardiac life support and just CPR, they talk about the ABCs. Well, the first two have to do with breathing, airway, breathing. Then you look for circulation, heart, and all that. But
right?
you got to have that airway and breathing, or else the heart's not going to be getting oxygen and it's going to get mad and conk out on you. So the airway and breathing is essential. And with asthma, that airway can be really clogged up at times and make life difficult. And as you can see, I mean, you can there's so many wonderful compensation mechanisms we have that you can feel normal even when you're sick. And the good thing about that is you're not feeling sick. The bad thing about that, we call it poker face asthma, is that it takes more lung dysfunction for you to feel bad enough to do something about it. So that's kind of the downside. So that's why we do things like set people up with peak flow meters and give them other cues as to whether or not they're breathing right. Because, like you said, this can be a revelation when you do start using the full capacity of your lungs, and you realize not only that, you're able to sleep better, you rest better, you're able to move around better. I mean, your attitude's better, everything's better.
Yeah,
So, yeah.
and it's a great thing, and you can just going up steps isn't labored. I mean, when I'm sick, it's really bad. Like the
Mm.
last time I really, really think I recall being sick, I just stayed in my room because it
Yeah.
was on the second floor and it was too
Yeah.
much energy for me to come down the steps. And I just stayed in my room. And my mother kept saying, "You need to go to the ER." And I was like, I don't really feel like going to the ER. So I'll just take care of this and I'll be fine. She was like, "You're going to have pneumonia. You won't move." And I was like, but I got this. I'm gonna be okay. So don't do as I do. Okay. So
Yeah. Yeah, it's a bit risky. Yeah.
Right, just a little bit.
Uh,
But I'm here. But
but
yeah,
parents have those cues though. She'd have snatched you up if she saw it.
right.
She saw
Yeah,
any
and plus
cues.
it wasn't like I was a child. This was
Yeah.
I was fully grown when this happened.
Oh, okay. Yeah.
Yeah,
All
I
right.
wasn't a child.
Oh, yeah.
I wasn't a
They can't
doctor
snap you
yet,
up
but I
then.
was an adult.
Okay. All right.
But I tell
Well,
everyone
adults can sometimes be a little risky
stubborn.
too,
Mhm.
especially young adults. Yeah.
Right. And
Yeah.
I mean, honestly, I tell everyone I was always a doctor because I would tell the doctor there was some medications that were just disgusting. And I would tell her, I won't be taking that again. So is there something else we can figure out?
Remember Arrowbeard? Yeah.
That's exactly what it was.
I know. Yeah.
I
Nobody liked the taste of that stuff.
off,
They
but
came out with a
that
menthol
other
at one.
one, the one that came with its own spacer, wasn't it asthma
Yeah.
something it was called?
That was asthma court.
That
Yeah.
was nasty too.
That was nasty. Yeah. We
Yes,
didn't have that
sir.
many complaints on that because it had the spacer and that would take away
A
some of
little
the
bit. But it was
larger particles. But
But
yeah.
I'm a cranberry juice drinker because I'm allergic to citrus fruits, everyone, and so I can't drink orange juice. So in the mornings I drink cranberry juice, and Aerobid did not mix well with toothpaste or cranberry juice.
Mm. Well, that's a healthy juice. That may be another reason you really turn the corner on things. Cranberries are some of the healthiest fruit you
Well,
can eat.
we were drinking Ocean Spray. Love Ocean Spray, no, but they didn't have
Mhm.
all the amazing varieties they have now because now they have one that's like no
Yeah.
sugar and
Yeah. Yeah. When they add sugar to it, it's two steps backwards.
that's what I'm saying. So
Mm.
back
Yeah.
then we didn't have because now you can get a healthy ocean spray, but back then we didn't have
Yeah.
that option. So I can't really give that cranberries too much credit. But I really do give a lot of the credit to the fact that I did work exercise and started
Hmm.
training for I did couch to 5K and slowly started being able to run for longer periods of time.
That's
And
good.
I've actually I think I've done half of You Can Run on the Peloton app
Okay.
and was like, "Oh, I can run for a longer. Okay, okay." And I've done several of the
Mhm.
run workouts and just ran for 20 minutes and was in a state of shock myself that I did it. But I
Yeah.
mean, and
Well,
mind you, this was
it's a
just last summer. Still in surprise that my lungs handled it. I was like, "Oh my god, I'm still standing."
yeah. Well, it's one thing that's nice about that is allows you a chance to kind of build on things, so you can make progress as you go.
Yeah, yeah.
Yep.
So I just, little by little. So can you explain the importance of the auto injector epinephrine? Because next week is
Yeah.
Food Allergy Awareness Week, in case no one knew.
Yeah. The auto injector has in it a what can be a life-saving medication. And it's actually a hormone, one of the hormones we make called adrenaline, also called epinephrine. And some people recall or rather refer to it as the fight or flight hormone.
Mhm.
So if you're sitting somewhere quietly reading a book in a dim room and someone comes up from behind you and says, "Boo!" It's that adrenaline that comes out and makes it so you either jump up and fight or run, and it works immediately to give you the energy, the burst of energy, tighten, makes your muscles in tone, and all of a sudden to do whatever you need to do. Well, they were able to package this and put it in a pen and in some other formulations that so you can inject yourself with it if you were to have a severe allergic reaction. And so allergic reactions that involve mainly three areas: the throat, the lungs, or the cardiovascular. Now, what do I mean by cardiovascular? Cardio means heart, vascular means blood vessels. If all of a sudden your heart starts beating slower or blood vessels dilate, your blood pressure goes down. And when it goes down, gravity makes it come down from the brain, and you could pass out and bump your head and go into shock if you're having a severe allergic reaction. So some food you're allergic to could do that. A drug could do it. Some people have allergy to antibiotics and find out, the hard way that
Mhm.
they shouldn't have it anymore. Or it could be even something called I don't like this term, but for lack of a better term, this is called fatality prone asthma. That's less than 5%, but that's where someone can go from 0 to 60, be feeling completely fine, lungs wide open in just minutes. They're tightening up and not even enough energy and enough movement of air to get the inhaler down,
Mhm.
the albuterol type of medicine in. And so those people need to carry EpiPens. A very small percentage of people that have that, but it's very scary because you can get sick so fast and not be able to breathe. And so the EpiPen is for that, and it's for anything that can cause a severe allergic reaction that involves those one of those three areas. We don't use it if you're just itching all over or have
Right.
hives all over. You take antihistamine, and maybe your lips just swelling, unless you've already had a scenario where your lip swells and then your tongue swells, then usually we're wanting to just have that EpiPen nearby, unless it involves your tongue, your throat, or feeling dizzy or lightheaded, or having trouble getting air in or out. But it can be life saving because within seconds it starts to kick in when used properly, and it bridges the time. It's not an end all. Some people use it. Okay, I'm gone. It worked in 5 minutes. I'm ready to do the next thing. No, 10 minutes later you could be back where you started. So they come in a two-pack, not so you can have one at work and one at home, or one at school and one at home. A lot of people did that through the years. But it comes in a two-pack so you have a second chance if there's a delay in paramedics coming to you, because once you use it, there's no turning back. You need to be checked, and you need to be checked timely. Best thing is to call 911. But say this taking a while. They're in traffic and 15 minutes have passed, and maybe it helped, but now you feel you're tightening up again in the throat or in the chest. You give yourself that second injection, maybe the other leg, and then it can bridge that time even more for you. So that all can help. What
So
you don't want to do is when your throat's closed and try to take that Benadryl, because you could gag and spasm, and worse than thing, you could suck it up into your lungs and really cause some intense problems. So if your throat's closing and you have access to EpiPen, Benadryl's not the answer.
he just threw that in for me. But
Okay.
because I have never, I quote, never used an epinephrine auto injector. And there's probably two or three occasions that I should have. But but I'm still here. But,
Okay.
like I said, don't do as I do because I live on the edge, as they say. But you have to, this is why it's important to have an action plan. If you have a child or you are an adult that has allergies, you have to have an action plan. If you, like he said, your blood pressure goes so low you can't function, someone needs to know where this auto injector is, and they need to know how to use it.
Absolutely.
So, so that's why it's really important that, the schools and, places like that know, airplanes, places like that know exactly what to do, because the person that it is affecting that probably does know how to use it may not be able to tell you what to do and may not be able to do it for themselves. So it's really important that the people around you, that are with you, understand and know. The other thing is, it is so important, and we've had them on the show before. Elijah's Echo Foundation, his parents, the Silveras. Elijah was in preschool, was given peanut butter, I think it was, and he was had a nut allergy. And I don't believe that they immediately gave him the auto injector. They called mom and said, "We think he's having." No, 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 no. You guys have to work immediately, because I know, like I said, I probably should have used it a few times. So I do know that my reactions happen very quickly. um, the one reaction I recall, I was eating a banana muffin and I don't know what was in it. I just know it made me sick. I literally ate a crumb. You could barely see the crumb that I ate, because I have these allergies, I know how to tread lightly. And so this is me treading lightly, hoping that this is a perfectly fine banana muffin. Sure enough, it was not. As soon as I put the crumb to my tongue and it went to the back of my throat, immediately I started having a reaction. I literally left my tray in the cafeteria. I didn't even walk to go and take it. I left it right there at the table and went to my dorm room and immediately medicated myself, because I knew I was starting to have a reaction. But that, I know how quickly they happen. And so, and then, because I've lived like this, I don't panic. But other people, when you throw in panic on top of the fact that your throat is closing, you're in trouble. You're in big trouble and you don't have a whole lot of time. So you need to definitely make sure that you have an auto injector or somebody near you knows how to use it, and you get it done quickly, because you don't have a lot of time. There was another story I just read. of a child that was, I want to say a high schooler that died in, I can't remember what state, a few weeks ago. And same thing happened. They were at some function and had something they shouldn't have eaten, and it just didn't happen fast enough and they didn't make it. So it's just really, really important that people understand food allergies are not something to play with. Food intolerances are totally different than food allergies. There's a difference. And, people with food allergies usually have anaphylaxis, and anaphylaxis is very serious. And like you said, your heart, your lungs, your throat. And especially if you don't know CPR, you probably want to make sure that you find their auto injector and you give that and call, and someone else is calling 911 at the exact same time. And the ambulance, they understand the urgency of what's going on. So they will definitely go into, if you haven't already done it, they're going to make sure that they give the person epinephrine anyway. So
Mhm.
it's important.
Yeah.
And with so
And
many
it,
people having them now, having food allergies now, it's really
mhm.
important.
Yeah, it's increased over the last 30 years. The percentage has gone up, and there's a lot of debate on why that is, but it certainly has increased. Number of people having asthma has increased. Number of people having allergies has increased. They think some of it may be due to this climate change, pollution,
Right.
uh, Western life. Yeah.
Now, would you do you have recommendations for your patients if they come in with one child with allergies and then they have another child, another baby after that? Do you have recommendations for the feeding of the second child so that perhaps they don't have the allergies like the first one?
I do encourage them to breastfeed at least for 4 to 6 months. That usually helps. No guarantee, but that it won't hurt, and it certainly builds the immune system up, and it has been associated with having less severe early onset of these kinds of problems, including asthma. Also, I recommend them not being fed too soon. Various, solid foods. Use a follow the pediatrician. A lot of times they'll let even like I've seen it. They may let a child nibble even at 3 or 4 months on some food. And that's not a good idea. Um, but interestingly, there was something called the LEAP study, learning early about peanuts. That, oh gosh, how long has it been? About maybe 5, 6 years in England, about almost like 600 children that they took from age 4 months to they tested them. They were high risk kids to develop peanut allergy, high risk because they either had egg allergy or eczema already.
Mm-hmm.
And so they know if you have either one of those or both, you have a higher risk of developing peanut allergy. And they took these kids and they had a control group where they didn't do anything, just let them, they restricted them rather. The control group, they restricted from peanuts until they were school age. And the other group, they, after testing and making sure they were allergic, because they did an oral challenge to really make sure they had symptoms, they then said, okay, the group that had oral challenge and were already allergic to peanut, they got kicked out. Then they had to split the group that wasn't already allergic, but just high risk because of eczema and because of egg allergy, into one group that would 3 times a week get this peanut paste. They had some peanut puffs or something in Europe. And then the other group, they said, okay, we're restricting no peanuts whatsoever. And guess what? More than it was like a 5 times, 4 to 5 times more risk of having peanut allergy if you restricted it from that period of time between 4 months and 11 months. So that was a game changer because there were some other studies that further corroborated that. And so now we don't tell women that are pregnant, don't eat shellfish, don't eat nuts, because it may cause your
Right.
child later to. We don't tell them that anymore. We tell them eat whatever, if you're not allergic to it, go ahead and eat it. And then when the child's born and starting to get table food, don't hold back on those peanuts. Now we tell them don't give them peanuts, of course. It'd have to be some kind of something they can gum and not have to
Right.
chew. But we tell them too if they already have eczema or they have egg allergy, get them tested first. Then if they test negative,
Introduce. Okay.
they can have it. But that can keep them by giving that early exposure from that can reduce their chances by a large percentage of developing peanut allergy. Which anybody that has a child that has peanut allergy, they know that is a big deal. All the school forms, got to have the epi, expires every year, year and a half. All this stuff. Got to talk with the teachers, talk with caregivers, make sure everything's straight. Some people are just that drives their life. So if you can prevent it, that's always good. But if a sibling, if an older sibling has it already, that's kind of a walking on eggshells a little bit because you're trying to keep peanut out of the house already. And now you got a younger child you want to give it to so they don't get peanut allergy. So it's, people, we have to assist people in kind of navigating through that so they don't get exposed themselves. Because some parents themselves have peanut allergy and then they don't want the kids to have it. But then now they've got to feed their kid this peanut butter. So, hopefully one of the parents don't have it.
Right. My
Well,
sister has zero allergies. She's younger than
yeah,
me. And
yeah.
currently, I am in my parents' home and they eat peanuts every day. I
Mm,
am allergic to every kind of a nut except for coconut. And
mm.
my parents eat cashews, pistachios, somebody's form of
They
almonds,
love them.
walnuts, something
Yeah.
every day. As a matter of fact,
Mm,
I make my father's oatmeal and he gets walnuts in his oatmeal. Now, do I touch these walnuts? No. But I shake them out the
yeah.
container into his thing and then I wash my hands. But yeah, I, we didn't eliminate at this house.
Yeah. Yeah.
I am the
That
only person
happens.
that is severely allergic to everything. And my mother was like, you knew what you couldn't have, so you didn't touch it and we didn't worry about it.
Yeah.
There is the one
Fortunately,
time I stuck the peanut shell up my nose, but
mm, okay. That's a one-time thing.
that was a one-time thing. I was jealous. They were over there, cracking them open and eating. It just looked so interesting to me. And nobody was paying attention. I did it, and my mother couldn't figure out what happened. All of a sudden, Renee can't breathe. What's going on?
Yeah. That could have been a worse outcome. I'm glad
It
you
could have
survived
been.
that.
Just like
Yeah.
the egg, it's in the book too about the eggs,
Yeah.
same thing. Mother not paying
Yeah.
attention because she's busy with her newborn. Where's Renee? She's awfully quiet. She's sitting in the corner cracking eggs and sitting there in a pile of eggs, wheezing. So
Mm. The angels were looking out for you.
they wanted me here so
Yeah.
I can help everybody else.
Right. That's right. But
Exactly.
interestingly, when I come across young people that have asthma, when parents bring them in, I do try to I do try to get them to do just a trial off of dairy, you know, while they're in control. Because once kids get older, it's too much
No
trouble
control at
if
all.
they like their milk and cereal and ice
Right.
cream. But when they're still under the thumb, school, grade school, and they're struggling with asthma, I would say about 50% of the time when they can really get dairy out of their diet, they can have other forms of milk, soy milk or
Right.
almond milk if they're not allergic to tree nuts. And 50% of the time their asthma becomes more manageable. Milk has a way outside of allergic mechanisms of causing more inflammation, and we're understanding that a little bit more. There's these glycoproteins, something called Nu5GC, that's on cells, but the Nu5GC is foreign to us. We have a Nu5, something called Nu5AC, but when we have something like red meat or dairy, that Nu5GC lands on the cells, and it can stimulate our immune system to cause inflammation. Inflammation in the joints. For some people older,
Mm.
inflammation in the lungs. So we think at least that may be in part what's going on. And so that's kind of what I think is low hanging fruit. Let's get him off the dairy first, him or her, and see if things turn around. And sometimes it's almost like magic. People do so much better.
Well, I
And so,
stopped having dairy in
yeah,
2017 and once again, didn't notice, but
yeah,
I was like, "Oh, I'm going to buy me some skim milk." And I think I had 1 cup of milk and immediately started and
yeah,
I go, "Oh my god.
yeah,
Oh my god. No!" And I'm a
yeah,
changed woman. It's going to be oat milk for Renee.
yeah.
Now, I
You
will
have
have
other
ice cream
choices.
every once in a blue moon. I probably have ice cream maybe 3 times in a year, but I don't like I used to eat yogurt a lot too. I just don't do dairy and I noticed the difference. I was like, I do not have to clear my throat anymore.
Yeah,
I'm not banging on my chest anymore. I don't hear anything when I inhale. Like it is just clear.
mm,
And I was like, this
yeah,
is amazing. So I am a changed person. I understand and I believe that dairy was
Oh yeah,
seriously causing inflammation in my system.
yeah. And people are healthy. I find there's a kind of mechanism this occurs in a non-direct way too when you get off dairy. A lot of these kids that are on the chubbier side, they also lose weight, and you could argue that that happens to help them too, because when they're not eating the cheese and the sour cream, and especially the cheese, they're not getting as much salt and saturated fat and cholesterol. So if they go to the vegan cheese or which the healthier vegan cheeses or no cheese, they start dropping some weight too, and that is an additional boon for getting good air down the lungs. So I think there are multiple ways that when you get off that dairy, you benefit.
Yeah. So, I mean,
Yeah,
it's like I said, changed my life because I was like, this
yeah,
is awful. It's like, I
yeah,
can't
yeah,
do this to myself. And
yeah,
as much as I loved skim milk, a good cold mug of skim milk, I was like, I'm okay.
yeah.
I Oat milk will make me happy, and it does.
Yeah, I love all the plant-based milks. Sometimes I have macadamia nut milk or something. You couldn't have that, but
No.
there's rice milk. I just if you do rice milk though, get the organic kind because some of the rice that they get, especially from just far south of where we are, has been tainted by fields being sprayed
Oh,
with
okay. Pesticides.
arsenic and stuff. So we don't need that. But
Right.
generally, yeah.
The rice milk. I've tried hemp
Mhm.
milk. I've tried pea milk.
Pea
Um,
milk.
yeah, that Ripple makes a
Yeah,
pea. Yeah, it didn't
yeah,
taste good to me.
yeah. No, I like the oat milk and some of the nut milks, but yeah,
Yeah, and
I
so
do not I do not miss cow's milk at all. I had lactose intolerance. 75% of people have
and
black people have milk intolerance, and 85% of Asians. So,
oh, really?
uh,
I didn't
uh,
know that.
yeah, they have it even worse. Yeah, yeah,
Yeah, I was grateful because I ate cereal milk all the times. I was grateful I did not have a lactose. I wasn't lactose intolerant.
yeah, yeah,
Because once I went to college is when I started drinking skim milk. Before that, everything was non dairy. But then I started
yeah,
drinking skim milk, and I was like, this is lovely. I'm great.
yeah. And
But
the thing about skim milk is it's got no fat, right? And
right,
that's one big thing about cow's milk is loaded with fat. But you know what most milk we drink is still loaded with? Sugar. Lactose sugar. And
yeah,
lactose sugar is sugar. I mean, it's a disaccharide, so it has glucose in it and galactose, whereas your table sugar is glucose and fructose. So, but that's the glucose. So the thing is, milk sugar is something else that is not healthy for us. So that's the other thing. Even skim milk has just as much lactose sugar as regular milk. So
it's just the fat.
yeah, well, it's the fat and the sugar.
Yeah,
Because sugar, when you overload sugar, it turns into fat. That's
yeah,
how that works. Yeah. Your body actually prefers to burn sugar. But what happens is when we eat a lot of fat with the sugar, like a lot of people don't drink skim milk, they drink 2%, and some people still like whole milk. When you have the fat and the fat could come with the cereal, or could come with, um, the muffin, the bread, and all that that has fat in it. And so now when you have the fat and the sugar, the body chooses to burn the sugar and store the
the fat.
fat.
Mm.
So sugar gets a bad rap, but our brain minute to minute needs sugar, and our muscles and liver needs sugar too. It's not so much the sugar as it is the fat, especially the saturated fat that infiltrates the cells and then makes us have to kick out more insulin because we get resistant, and then we start making more fat from the excess sugar, and one thing leads to another. So
And there's type 2 diabetes. Uh,
yeah, that's right. Type 2 diabetes, which is so reversible. Until I got certified in nutrition coaching, I didn't know these things that you can actually reverse
yep,
hypertension. You can reverse type 2 diabetes by diet and exercise. You
yep.
really can. Not every time, but
Not every time, but a lot of times.
most times,
Right.
most
Food is
times. Yeah.
medicine. I keep telling people
Food is medicine.
medicine. You just have
It
to
sure
treat
is.
use it right, use it
Yep.
properly. But thank
And
you
there's some
so
stuff.
much, Dr.
Yeah.
Thompson, because
Oh,
first
sure.
of all, I have to tell everyone, Dr. Thompson was kind enough to
Mm.
edit the second half of my book, which is completely all about asthma and allergies and We talk about some of the latest treatments and things that work, and we talk about signs and symptoms and all that great stuff. So the first half of the book is my story, and then the second half is that. He was nice enough to edit that for me. And if you buy the book, you'll see I have a lovely thank you to him in the back of the
It's a
book.
great book. A great book. You
Thank
did
you.
a
I
great job on there. There's a lot of information. That's why I got copies I could give to patients. So,
appreciate you. Appreciate you. But
okay.
next week, you
Thanks.
guys, is Food Allergy Awareness Week, and we're working hard to get it locked in. But I know Tuesday we have a black woman who created a food brand that, out of necessity because of allergies, she created it, and she's gotten lots of funding, and it's in big stores and stuff. So I can't wait to
Hmm,
talk to her. It's really, really
that's
exciting.
great.
Yeah, I'm very excited. And she's actually sending me some stuff. So I can't wait to try it too. But
Mm,
there's a lot of really great stuff on the market. So I'll let you know about some of the stuff that I've discovered that is nut free or gluten free, dairy free, vegan. There's a lot of stuff that it's actually could probably end up being healthier for you than the regular stuff, but it is definitely allergy friendly. And that's one of the things a lot of people are like, oh, my kid can't have. So then you think you can't go get snacks. But this lady has created these snacks that are allergy friendly. So
mm.
you guys, I will see you next week. And thank you so much, everyone. And see you next time.
My
Bye.
pleasure. Happy Mother's Day, folks.